Our cover story now, a new study finds that LGBTQ plus identifying people are at a higher risk of some cancers, possibly due to fear of discrimination. ABC News medical correspondent Dr. Darien Sutton joins us now to break it all down. Good to see you.
Good morning. How are you?
Good morning. Okay, so this is pretty surprising. Tell us about the study.
Well, this is the first ever report of its kind focusing on cancer rates, reports, risk factors, specifically within the LGBTQ plus community. And the reason why that's been difficult is because it's been very, very hard to get that information from medical records. If you can assume, or you can think about trying to extract that information from multiple medical records to figure out what risk factors are focusing on or we should focus on, has been forever difficult. One of the most important numbers here is that 1 million people within the queer community are currently living with cancer. And we know that these disparities, 1 million, and we know that these disparities or worse outcomes exist. We're talking about delays in the diagnosis. We're talking about misdiagnosis, worse outcomes, also in certain cancers, an increased risk of recurrence. So in this report, they were able to identify some causes to that. One of them being behavioral factors. For example, there's a slightly but statistically significant increased risk of alcohol use and cigarette smoking, which of course is associated to an increased risk of cancer. But as what you alluded to, one of the big factors here is fear and experiences with discrimination. And it's warranted because there are currently 9 states that allow or make it legal to discriminate against people based off of their gender identity or their sexual orientation. So that fear is warranted, and it means we've got a tremendous amount of work to do.
So knowing that, how do people find providers they're comfortable with?
You know, I think first and foremost, understanding what are your options. Checking in, for example, with your insurers to figure out, some insurers have directories that can direct you toward allies. Of course, checking in with your friends, your family, because sometimes people have great recommendations. And then there's often wonderful organizations like the GLMA, the Gay and Lesbian Medical Association, that can help to find resources for you within your community.
And you and I know so many in our community are facing emotional stress, deep emotional stress.
Yeah.
I know you wanted to make sure to talk about the resources available.
Well, I think it's important to talk about resources for mental health. Within our community, there's higher rates of depression, higher rates of suicidality. So knowing about organizations like the Trevor Project, the LGBT National Helpline, and also the Trans Lifeline, these are great organizations that in many cases can provide 24/7 options so that you can at least have someone to talk to.
All right, Dr. Darien Sutton, as always, pleasure. Thank you so much.